Did you know that nearly 40% of women over 65 experience urinary incontinence, yet fewer than half ever discuss it with their doctor? If you or someone you love has been dealing with urinary concerns, you're not alone, and more importantly, you don't have to suffer in silence. What I'm about to share with you today could help restore your confidence and improve your quality of life significantly. These aren't just minor inconveniences we're talking about. When left unaddressed, urinary health issues can lead to skin problems, infections, social isolation, and even an increased risk of falls due to rushed bathroom trips. Over the next few minutes, I'll walk you through 7 common mistakes that many women make when dealing with urinary health changes, and I'll give you practical, actionable steps you can take starting today. Plus, I'll share one crucial insight at the end that most healthcare providers wish their patients knew but often forget to mention. If maintaining your independence and feeling confident in your daily activities matters to you, subscribe to Elderly Health Central. We're here to provide you with reliable, research-backed health information that can make a real difference in your life. And if you're ready to take control of your urinary health today, comment, "I'm ready," below. Now, let's dive into these 7 mistakes that could be affecting your urinary health without you even realizing it. The first one might surprise you because it seems so logical. Mistake number 1, limiting fluid intake. Picture this: you've started avoiding drinking water because you're worried about frequent bathroom trips or accidents. You think you're being smart by cutting back on fluids, especially before going out or before bedtime. Here's what research shows us. When you don't drink enough water, your urine becomes concentrated, which actually irritates your bladder more and can worsen urinary symptoms. Studies indicate that adequate hydration, about 6 to 8 glasses of water daily for most people, helps maintain normal bladder function and reduces the strong, sudden urges that catch you off guard. Most families think reducing fluids is the logical solution, but here's what's really happening in your body. Concentrated urine creates a cycle where your bladder becomes more sensitive and reactive, leading to more frequent urges, not fewer. Additionally, dehydration can contribute to constipation, which puts extra pressure on your bladder. The immediate action step is simple: aim for consistent, moderate fluid intake throughout the day, with most of your fluids consumed earlier rather than right before bed. If you're experiencing urinary symptoms, consult your healthcare provider about the right fluid intake for your specific situation. But limiting fluids isn't the only mistake that can backfire on your urinary health. Mistake number 2, using the wrong hygiene products. You walk down the personal care aisle and reach for heavily fragranced soaps, douches, or feminine sprays, thinking they'll help with odor concerns. Or perhaps you're using baby wipes or adult wipes constantly throughout the day. The science behind this is clear: the delicate tissues around your urinary and vaginal areas have a natural pH balance that protects against harmful bacteria. When you use harsh soaps, fragrances, or alcohol-based products, you disrupt this protective barrier. Research published in urological journals shows that this disruption can actually increase bacterial growth and worsen odor problems. Here's what most people don't know. Over-cleaning or using the wrong products creates a cycle where you feel like you need to clean more, but the products themselves are making the problem worse. Your body's natural defenses become compromised, leading to increased risk of urinary tract infections and persistent odor. The solution is surprisingly simple: use only mild, unscented soap and water for daily cleaning. Pat dry gently rather than rubbing. If you're using incontinence products, change them frequently and allow air circulation when possible. Always consult your healthcare provider if you notice persistent odor, as it could indicate an underlying infection that needs treatment. This next mistake is one that even well-meaning healthcare providers sometimes overlook. Mistake number 3, ignoring bladder training opportunities. Let's say you feel the urge to urinate and immediately rush to the bathroom, even when the urge isn't urgent. You might think you're preventing accidents, but you could actually be training your bladder to hold less urine. Here's the crucial science: your bladder is a muscle that can be retrained. Studies show that healthy bladders can typically hold 300 to 500 milliliters of urine comfortably. When you respond to every small urge immediately, you're essentially teaching your bladder that it needs to empty when it's only partially full. Most families assume that going to the bathroom the moment you feel any urge prevents accidents, but here's what's really happening. You're creating a pattern where your bladder sends stronger, more frequent signals because it's learned that small amounts of urine trigger immediate emptying. The immediate action you can take is gradual bladder training. When you feel a non-urgent urge, try waiting 5 minutes before going to the bathroom. Gradually increase this time as you feel comfortable. Practice relaxation breathing during the wait. However, never ignore truly urgent signals, and always discuss bladder training techniques with your healthcare provider to ensure they're appropriate for your specific condition. But there's another mistake that affects not just your bladder, but your entire pelvic floor. Mistake number 4, neglecting pelvic floor health. You might think that Kegel exercises are just for new mothers, or perhaps you've tried them but didn't notice immediate results, so you stopped. Maybe no one ever taught you the correct technique. Research consistently shows that pelvic floor muscles support your bladder, uterus, and bowel. As we age and estrogen levels decrease, these muscles naturally weaken. However, studies indicate that properly performed pelvic floor exercises can improve urinary control by up to 80% in many women when done consistently over 6 to 8 weeks. Here's what most people don't realize. Many women perform Kegel exercises incorrectly, either using the wrong muscles or not maintaining the exercises long enough to see benefits. You might be bearing down instead of lifting up, or holding your breath instead of breathing normally. The correct technique involves imagining you're stopping the flow of urine midstream, then lifting those muscles up and in. Hold for 3 to 5 seconds, then relax for 3 to 5 seconds. Aim for 10 repetitions, 3 times daily. The key is consistency rather than intensity. Your healthcare provider or a pelvic floor physical therapist can help ensure you're using proper technique and provide personalized guidance. This next part is crucial because it involves something you might not think affects your urinary health at all. Mistake number 5, overlooking dietary triggers. You love your morning coffee, your evening glass of wine, or that spicy meal that brings back fond memories. You might not realize these foods and drinks could be contributing to your urinary symptoms. Studies show that certain substances can irritate your bladder lining, leading to increased urgency, frequency, and sometimes incontinence. Common culprits include caffeine, alcohol, artificial sweeteners, citrus fruits, tomatoes, and spicy foods. What's particularly interesting is that sensitivity to these triggers often increases with age. The solution isn't necessarily to eliminate everything you enjoy, but to become a detective about your own patterns. Keep a simple food and symptom diary for 1 to 2 weeks. Note what you eat and drink, and track your urinary symptoms. You might discover that reducing your coffee from 3 cups to 1 cup makes a significant difference, or that spacing out citrus fruits helps reduce urgency. Mistake number 6, delaying medical consultation. Perhaps you think urinary changes are just a normal part of aging that you have to accept. You might feel embarrassed to discuss these issues with your doctor, or worry that the only solution will be surgery or medication with side effects. Here's what current medical research tells us. While some changes in urinary function can occur with aging, significant incontinence or persistent symptoms are not inevitable and often have very treatable causes. Early intervention typically leads to better outcomes with less invasive treatments. The mistake families often make is waiting until symptoms severely impact quality of life before seeking help. By then, simple solutions that might have worked earlier may no longer be sufficient. Schedule a conversation with your healthcare provider if you're experiencing any persistent urinary symptoms. Come prepared with specific information about when symptoms occur, what seems to trigger them, and how they're affecting your daily life. Mistake number 7, using incorrect incontinence products. You might be using regular menstrual pads for incontinence, thinking they're essentially the same thing. Or perhaps you're wearing incontinence products that don't fit properly or aren't designed for your specific type of incontinence. The science is clear, urine and menstrual fluid have different compositions, and products designed for periods don't effectively manage urine. This can lead to skin irritation, odor, and reduced protection. Choose incontinence products specifically designed for urine. Ensure proper fit. Products that are too small or too large won't provide adequate protection. Change products regularly, and consider speaking with your healthcare provider about the best options for your specific needs. Now, here's the most important insight I promised you, and it's something that can change how you approach urinary health entirely. The biggest mistake is thinking you have to handle this alone or that your concerns aren't worth addressing. Your urinary health directly impacts your confidence, your social connections, your sleep quality, and your overall well-being. Taking steps to address these concerns isn't vanity, it's an investment in maintaining your independence and quality of life. Aging with dignity isn't about avoiding every physical change, it's about recognizing changes early and responding with knowledge and appropriate care. You have more control over your urinary health than you might think, and small changes can often lead to significant improvements. Remember, millions of women navigate these challenges successfully. You're part of a community that understands, and there are healthcare providers who specialize in helping with exactly these concerns. If this information has been helpful to you, subscribe to Elderly Health Central. We're committed to providing you with reliable, respectful health information that helps you feel more confident about your well-being every single day. Let me quickly recap. Proper hydration, gentle hygiene, bladder training, pelvic floor exercises, awareness of dietary triggers, timely medical consultation, and appropriate products can all significantly improve your urinary health and confidence. I'd love to hear from you in the comments. Which of these insights was most helpful, or what questions do you still have about urinary health? Your experience and questions help me create content that truly serves this wonderful community. Next week, I'll be sharing crucial information about maintaining bone health as we age, including 3 simple exercises you can do at home that research shows can help prevent falls and fractures. Your health is one of your greatest assets. By staying informed and taking proactive steps, you're investing in years of continued independence and vitality. I'll see you next week with more evidence-based health insights that can make a real difference in your life. Take care, and remember, you deserve to feel confident and comfortable in your own body at every stage of life.